Hi there. This video is a demonstration of the pop-ups that you may have in place for blood pressures. They won't appear if the blood pressure is normal, but if it's particularly low or if it's above target, they'll appear. And how they appear and what information and options they give depends on your role. In this video, I'm going to show you how it would work if I was, say, a nurse or a HCA and I'm taking a blood pressure. So here in the recall overview, I can see what their target is and what their last one was. I'm going to record one now that's sort of mildly elevated. If it was very high, then you get a slightly different pop-up that you're about to see. What's that doing? There we go. If it's very high, it will advise patients being reviewed before they leave the building. But more often than not, it's this sort of scenario. It will look at whether the patient's already diagnosed with hypertension, whether they're on medication. It will work out what their target is and compare the BP you've recorded against the target. The idea of this is to make it nice and simple for you to manage BPs and make sure they're managed consistently and safely. There are options here that you might occasionally use. There's one for home BP declined, but there's a warning to kind of read out to the patient. We want them to understand the risks of not treating raised BP. Patient not present is more aimed, say you're managing letters and you're coding a BP off a hospital letter, then that option will take you straight to a sort of more appropriate stage. More often than not, hopefully we're going to be picking this first option, which is to arrange home BP. And so the question is, does the patient have access to a BP monitor at home? What the system will do if the answer is no depends a little bit on your practice and whether you loan BP machines. We always are trying to make these self-explanatory and generate appropriate messages for patients. In this scenario, I'm going to put yes. And so this has generated a preset message, basically explain a bit about why it's important. It's attaching a questionnaire that the patient can use to complete their readings, and it's going to code it as an invite. I click send, and if I look in journal, I'll be able to see some documentation that accompanies that, if it ever gets there. So we can see what kind of outcomes have been. Advise patient to provide home BP readings. These QOF codes are because this practice has opted to have these recorded at the time. BP is a really major target at the moment for QOF, but there can be a challenge if the patient attends for the review, but then doesn't engage with follow-up that's asked of them. Hence the reason for coding these invites now. And if they don't respond, they can get further follow-up invites sent. As always, our pop-ups try to be self-explanatory. You could try different scenarios on a test patient like this, or even on a real patient, but just don't hit save. But we hope you find them useful and help you improve patient care. Thanks.